Hi guys, my name is Jenna Rhodes and I'm going to be doing a head-to-toe assessment on my patient right here. Okay. So to start off, I've performed hand hygiene. I'm going to come in and provide privacy and speak to my patient. I'm going to ask them 4 questions: what their name is, their date of birth, if they know where they're at, what year it is, and then just ask them what we're doing, which is the head-to-toe assessment, make sure that's okay. Okay, first off, we are going to go through, during this time too, I'm going to check and make sure they're not in any type of distress, they're conscious, of course, and make sure that their speech level is up to par and there's no signs of stroke or anything like that. So first off, we're going to inspect the head. We're going to check for symmetry, hair, and any type of lesions. So his hair looks good even up under his hat. That's good. For eyes, we are going to be inspecting the color, for edema, symmetry, and alignment, which everything looks awesome. And then for the ears, we're going to check them, make sure both of them are around the same size, no lesions or anything like that. Check for symmetry. Make sure they're not having like any type of hearing aids or anything like that. And then for the nose, we're going to inspect symmetry, make sure there's no type of deviated septum. We want to make sure there's no congestion, no drainage, and then of course inspect for shape. For the mouth, we're going to check the lips, the hard and soft palate, the oral mucosa. We're going to check the gums, the teeth, and then of course like check and see if there's any dentures or anything like that. I'm going to palpate the carotid pulse one at a time. That seems okay. And then I'm going to check the chest and make sure that that is okay as well. My patient is already at the 30 to 45 degree angle that you want to check. I don't see any type of heart devices. And then I'm going to go ahead and assess the heart rate and rhythm. So I'm going to check right here at the mid-clavicular line. And then we're going to go down to the 5th intercostal line. Everything looks good there, so now I'm going to check the lungs. So right front, there are 6. I'm going to have them inhale, exhale for each point. So 1, 2, 3, 4, 5, 6. And then I'm going to see if they've had any type of cough, if they've had any type of sputum, shortness of breath with activity, or when just in daily lives not doing any type of physical activity. And then I'm going to go ahead and assess the arms. During all of this, I'm going ahead and assessing the skin as well. I haven't seen any type of lesions or anything like that on the skin that makes me worried up until this point. So for the arms, I'm going to assess the temperature with the back of my hand. Make sure neither one of them's hands are at a weird range. I'm going to check the brachial pulse with both hands. I'm going to do the radial pulse, and then I'm going to check for capillary refill. Then we're going to go ahead and do the abdomen. So I'm going to go through and inspect for contour, weird characteristics. Everything is moving up and down as it should be. No weird bulges or anything like that. And then I'm going to also take for the 4 quadrants. One, 2, 3, 4. And then I'm going to palpate. I'm going to ask about the appetite, when their last bowel movement was, if their appetite has been sufficient, if there was any vomiting, diarrhea, or constipation, anything like that. Luckily, everything is looking awesome. I want to make sure they haven't had any trouble urinating and chance of a UTI. Then we're going to move on to the legs. I'm going to check for edema, make sure the color even check for leg hair and stuff like that, just to make sure there's no underlying issues with that. Then I'm going to palpate the pulses. I'm going to do the femoral pulses, posterior tibia, dorsalis pedis, and then I'm going to take and have them push against my feet. And I'm going to press down on their toes and do this as well. I'm going to have them grab my hand and make sure when they're squeezing my fingers that there's not one hand that's way more stronger than the other one. And then I'm going to make sure that all the skin is done on the legs as well when I check for edema. I'm going to make sure there's no pain or discomfort. They don't have any immediate needs. And then for my last step, I'm going to go through and also take for the lung sounds on the back. So I'm just going to have them sit up. We have 8 places to check this time. So 1, 2, 3, 4, 5, 6, 7, 8. And you just want to make sure that they are inhaling and exhaling for all of those. Make sure they're good, content, in a safe position, and there's nothing that they need entirely. And then that is going to be our full body assessment. Thank you.